Hi, my name's Gavin and I'm a consultant psychologist here in Salisbury and I'm the head of the clinical psychology department here at the hospital. Welcome to this webinar on managing and overcoming low mood. It's one of a series of webinars that we've recorded as a department that we hope will be helpful to you and your loved ones in terms of some of the psychological issues that can arise when you're experiencing physical health concerns. So we'll be providing some information, but more importantly some tips and advice on how to manage some of those difficulties. So within this particular webinar, we're going to start off by looking at signs and symptoms of low mood or depression. We'll move on to think about how common low mood or depression is, particularly in the context of physical health concerns. We'll then think a bit about why depression might happen in the first place, and more importantly then look at what keeps depression stuck. And at that point I'll introduce one particular psychological model that can help us to understand the depression cycle, and it's one of a few that exist. We'll then look at a step-by-step approach to tackling low mood or depression, and the webinar and the slides are very much designed to be something that you might watch in one sitting or you might dip in and out of. The approach to tackling low mood or depression is often something that you might try over a series of days or weeks, so you might choose to watch the webinar up to a certain step, pause it, try that step out for a while, and then come back and watch the next step within that approach. So in terms of some of the signs and symptoms of low mood and depression, firstly, the kind of things that go through our mind. So often when we're experiencing depression or low mood, we experience quite pervasive negative thoughts about the past, about the present, about the future. We might also find that we're having negative thoughts about ourselves, about other people, or about the world. Often our thoughts can become quite self-critical. We can also find it harder to concentrate and feel indecisive. Alongside some of those things going on in our brain, we might notice some emotions. So often we might feel low or down or flat. Sometimes people describe a lack of emotion, so a sense of numbness. Often there might be a loss of enjoyment or a loss of interest in doing things or loss of motivation. Sometimes people might start to feel excessive guilt. They might feel hopeless or helpless. And again, some people, when they're experiencing low or depressed, might find that they're more irritable, less tolerant, more snappy. Sometimes, when people are experiencing low mood or depression, they might notice some physical changes or physical symptoms. So we see people who describe that they feel quite lethargic, so they feel kind of lacking in energy. They might feel quite fatigued. Sometimes people notice changes in their appetite, and that could be either way. So sometimes people feel more hungry, or they find that they're eating a lot more. Sometimes it's the opposite, and people just don't have an appetite and reduce how much they eat, and might even notice that they lose some weight. Again, with sleep, sometimes people describe changes in their sleep when they're feeling particularly low or depressed, and that might go either way. So sometimes people struggle to sleep, or they sleep a lot less. They might have a wakefulness. Other people might describe they're sleeping excessively, so they sleep for long periods of time in the night, or they might even sleep for excessive periods during the daytime. Sometimes people might experience a loss of sexual interest. And sometimes people might experience an increase in aches and pains, and that can impact on their physical health issues and some of their physical health symptoms. And finally, when people are low or depressed, that can often affect what they do or some of their behaviours. And so, some of the common things that might happen are people start to withdraw. They might withdraw from activities. They might withdraw from socialising or from social circles. They might become less active. Sometimes people zone out. They might find that they're spending a lot of time ruminating over things. And for some people, they might start to increase alcohol or drug use as a way of managing or trying to manage their mood. So these 4 boxes aren't exhaustive. They don't include absolutely every symptom, but they include some of the typical or common signs or symptoms that people might experience when they're low or depressed. As mentioned before, sometimes feeling low or depressed can affect the thoughts that people have and some of the actions or behaviours that they do. And when people are low or depressed, sometimes they might experience suicidal thoughts or thoughts of self-harm. So we would just say if you are noticing those or concerned about those, then we would encourage you to contact some of the mental health crisis services that are available and support that's available. Some of the most common ones are you can use NHS 111, and if you select option 2, that will connect you to a local mental health crisis team. If you don't feel able to speak verbally, then you can text 85258, and if you text shout, then you can have a text conversation with someone. If you don't want to speak to an NHS-based service, then there's Samaritans or Childline, and at the bottom there we've also included some of the local numbers depending on where it is that you're living. So how common is depression or low mood? Well, there are lots and lots of studies that look at how common it is across the world and different countries. The World Health Organization, when they look across all of these studies, suggests that around 5% of adults globally experience depression. When we look at this specifically for people with physical health concerns, we see quite an increase in the number of people who might experience low mood or depression. So for people with a cancer diagnosis, often the rates are around 20 to 25% of people. For those with a diabetes diagnosis, it's even higher. So studies suggest that 30 to 35% of people with diabetes experience low mood or depression. For people with burns injuries, the figure's around 37%. And for those who've been in intensive care as an inpatient, the research suggests that around 23% of people experience depression or low mood after they've been discharged. So again, this isn't an exhaustive list of all the physical health concerns or conditions that some of you watching the webinar might be experiencing or your loved ones might be experiencing, but it just gives an illustration of how physical health concerns are often associated with higher levels of low mood and depression. So why does it happen? First off, I think there's a really important point for us to note and be aware of, and that's that no one chooses to be depressed. It's not something that anyone would choose to be. So often, it's as a result of either external influences, and that might include things like difficult life events, past or recent, traumatic experiences, life changes, life stressors, burnout, and all of those things can relate to physical health. So it might be difficult life events related to the physical health condition. It might be traumatic experiences around a hospital admission, for example. There might have been some life changes or a need for more recent life changes due to a physical health condition. We might experience burnout. So for example, we know that burnout is quite common for people with long-term conditions like diabetes, and that can then lead to depression or low mood. But there can also be internal influences. So sometimes an illness can trigger low mood or depression. Sometimes an injury can be the trigger. Sometimes medications, one of the side effects of the medications can be an effect on your mood. Sometimes there are chemical changes as a result of treatments that you're having or medications you're taking. So for example, if you're having chemotherapy, that can lead to chemical changes in your body, or you might be having hormonal treatment that leads to hormonal changes in your body, and those things can trigger or feed into low mood and depression. So there's a range of things that can influence and cause or worsen depression or low mood, both external and internal. But what keeps low mood or depression stuck? So this is just one model, but it's often a model that can be really helpful and really applicable for people with physical health concerns. And that's the model that we're going to use for the rest of the webinar in terms of our step-by-step approach to trying to overcome low mood or depression. And this model, if you wanted to find out more about it, is based on something called behavioural activation. So here's how behavioural activation understands low mood or depression. It starts with life events, and here it's talking about recent life events, so we're not delving into a whole life history. We're looking at recent events that might have been a trigger for low mood or depression, or a worsening of low mood or depression. So in the context of physical health, that might be an illness or an injury or a new diagnosis. It might be a hospitalization, it might be treatment, or it might be due to wider events. And the idea is then that those negative life events, those recent life events, lead to life being less rewarding. And there might be different reasons for that. So firstly, it might be that you're unable to do the things you used to be able to do because of the physical health concern or the treatment or the injury or illness. It might be that you are more isolated. So often if people have been an inpatient for a prolonged period of time, they might experience low mood or depression because they have less social contact, or they might be more bored. It might be that it's harder to do things because of a treatment regime or because of the physical health constraints. It might be that you enjoy things less. It might be that they're more effortful, or it might be that there are relationship changes. So, for example, we see a number of patients who have had or being treated for cancer who experience a loss in sex drive, or they might experience erectile dysfunction, and that might lead to relationship changes. So the idea is that those life events lead to life being less rewarding for a variety of reasons. And understandably, that then leads to depressed feelings and thoughts. And we talked about some of these on the previous slide around signs and symptoms, but this might include things like feeling sad or down or numb, hopeless or helpless or lonely, might include guilt, it might include some of that anger and irritability, it might include feeling exhausted. So it might be that not all of these things are true for you or for your loved one, but you might notice some of those as being true and resonating for you. So that first 3 steps are behavioural activation's way of making sense of what causes us to start to feel depressed in the first place, or causes us to feel a worsening of existing low mood or depression. The model then suggests that because those depressed thoughts and feelings aren't nice, we try to find ways of coping with them. And they describe that as attempts at coping. And some of those things, again, we've discussed on the previous slide, might include withdrawal, isolation, disengaging from activities or people. It might include avoidance of certain things. It might include sleeping more or less, might include a lot of time spent ruminating or thinking over and over things. And it might include substance use or an increase in substance use. All of those things are designed to try to help us to cope with those feelings, which is understandable because those feelings aren't nice. So of course we're going to want to try to cope with them or suppress them or distract from them in some way. And at some levels, some of those attempts at coping can work. But there's a big but in here. And that's the next bit in the model. So often the strategies that we've got listed there lead to unintended consequences. The biggest element of that is a worsening depression, but some of those unintended consequences might include things like life being even less rewarding. So if I withdraw, if I disengage from activities or from people, then it might well be that my life's less rewarding. I might feel more isolated. I might feel worse. I might feel guilty because I'm not keeping in contact with people. It might lead to conflict with people close to me. It might lead to a financial cost. So if I start to increase my substance use, then there's a cost attached to that. And ultimately that then might feed back into life being less rewarding, and it might feed into an increase in depressed feelings. So we end up in a vicious cycle of depression and a worsening downward spiral of depression. So what I'd invite you to do now is to just pause, take a few minutes to think about how the cycle might apply to you or to your loved one who you're watching this webinar with them in mind. So once we've thought about what keeps depression going or low mood going, the key question for us obviously is how do I break that cycle? How do I stop that cycle from happening? So we know that the negative life events are outside of our control. Sometimes they might have already happened, so they might not even be current. So that's something that we can't necessarily control. So what we focus on is what are the things that we might be able to have some impact or influence on. And the first thing is around how rewarding life is. So we might start to look at, are there things that we can do that start to increase how rewarding our life is, the number of pleasant or pleasurable things that we have in our life again. And the second area that we might focus on is our responses or our attempts at coping at times that we feel particularly depressed, to try to avoid some of those unintended consequences and that downward spiral of low mood or depression. So we're going to look at that step by step over the coming slides. And as I said at the beginning, this is very much an approach that you might apply over a series of days or weeks rather than all in one hit. So you might decide that you want to watch all of the next slides together, or you might decide that you want to dip in and out and try things out in between. So step one in terms of how you break that cycle is mood activity monitoring. So for mood activity monitoring, what you would start to do is to try to keep a record of what you're doing through each day, no matter how small some of those things might seem. So I would include things like if you have a wash, for example, or if you have something to eat. I'd include watching telly. I'd include sitting on the sofa or in the armchair. So no matter how small those things might seem, I would still include them in that record if you can. And then we're going to rate your mood while you're doing them from 0 to 10. So 0 is the lowest you could ever feel, and 10 is the happiest, the brightest that you could possibly feel. As a tip, it's helpful to try to complete the mood rating as close to the time of the activity as possible, because the further afterwards it is, the harder it might be to remember exactly what your mood was like at the time. And don't worry if you miss some times or some time slots or some days. It's quite common when people first start doing the mood activity monitoring that it's hard to record absolutely everything. So here's an example of a mood activity diary. So this is broken down by days of the week and broken down into hour-long chunks. We would start it at the point that we typically wake up and end it at the point that we typically go to sleep. It might be when we're recording this, as you'll see, that there are batches of 2 or 3 hours where we're doing the same activity, and that's fine just to condense them all into one. So here's an example of a completed mood activity diary for a Monday. So as you can see, there are a couple of gaps in there. So the person who completed this hasn't filled in every single gap. There are time slots where something has gone on for 2 or 3 hours and they've just given a rating for that whole period of time. So as you can see, the day started, they woke up, they stayed in bed, their mood wasn't great while they were in bed, it was about a 1 out of 10. They then got up and fed the dog and rated their mood as a 3 out of 10, tried to eat breakfast, mood wasn't great, so it was a 1 out of 10 perhaps. It was difficult to eat breakfast because of their physical health condition or the side effects of treatments. And then 10 to 11 they watched Homes Under the Hammer and mood was around a 4 out of 10. They then had tea with someone called Mike, that might be a friend or a loved one, and their mood was again about a 4 out of 10. Then watched Politics Live, mood dipped to 1 out of 10. So you get the idea of what they've recorded there. So once you've done mood activity monitoring, and I would suggest doing it for a few days rather than just reviewing it at the end of a single day. So I'd suggest maybe doing a full week of mood activity monitoring before you do this next step. So the next step would be that you review your diary. And we're particularly interested in when your mood was highest or higher. So I've circled a couple in that example that we saw on the previous slide. And what can be helpful then is to think about what was it about that activity that lifted your mood. So in this particular example, perhaps the person enjoyed watching Homes Under the Hammer because they like home improvement projects and they find it interesting to see what people do with houses. Or perhaps they find the presenter dishy. For the afternoon, it might be that it wasn't the feeding of the dog particularly that was enjoyable, but that the dog was very affectionate in that time and there was lots of interaction with the dog and stroking and cuddles with the dog. The phone call with Janet, it might be that that's a friend who they haven't spoken to for a while, and what was particularly helpful or lifted their mood at that point in time is speaking to a friend and reconnecting with people or recontacting people who they hadn't been in contact with for a while. So hopefully that makes sense. So we're spotting times when mood was higher. So we're not looking at the heady heights of 9s or 10s necessarily, but just where it's higher than what the average might be and what it was about those activities that lifted mood. So once you've done that, step 2 would be to start activity scheduling. So here we're asking ourselves the question, are there opportunities to do more of the things that lifted your mood? And we're not looking at cramming days with them, we're being realistic, but are there opportunities to do a bit more of those things that lifted your mood or where your mood was a bit higher? It can be really helpful to start off with things that you are already doing, because it might be more likely that it's going to be easier to do those things and to stick with doing those things when you plan them. But we might then also extend to thinking about other things you might be able to do. And that might be things that are similar to what you're already doing that lift your mood. And again, that is because they stand a better chance of you doing them, but they also might stand a better chance of lifting your mood. So for example, the person in our previous examples might schedule time to groom the dog. They might schedule time to speak to other friends or family. It might be that we start to look at, are there things that you did before that you could restart, and it might be that there need to be adaptations, or it might be that you need to do that in small steps. So for example, we often work with people who maybe have done physical exercise, so maybe they enjoy cycling, and they might look to restart cycling, but it might be that they need to start with smaller distances, or it might be that they look at getting a bike with a motor so that they can have supported cycling. For some people, that might not necessarily be feasible, so they might start to look at, are there new things that you'd like to try? I remember I saw someone recently who said they'd always wanted to learn to crochet. So they bought a crocheting kit and watched some videos and taught themselves how to do it and really enjoyed that. Something else that can be useful when you're thinking about activity scheduling is to consider what's important to you in your life and what activities do you really value. So we see a number of people who really value activities that are linked with nature. So activities might be something as simple as spending some time looking out at the garden or spending some time in the garden, even if they're not physically able to do gardening. Once you've then identified some of those things, you start to plan when you'll do them. And there are different approaches to this, and that might depend a bit on how you operate as an individual anyway. So some people prefer to just identify, well, on this day I might do this thing or I might do something off of my list. Some people might prefer to pin down a specific time. So on Monday afternoon I'm going to do something off the list. Some people might prefer things to be even more specific than that and say, well, on Monday between 2 and 4 I'm going to phone Janet again. So you can tailor it to what works for you and what your style might have been historically. It can be helpful to think about what might make it more likely you'll follow through on it. So if you write it on a calendar, if you put a reminder in your phone, if you tell someone else that you're going to do it. So there are lots of different things that might make it more likely that you'll follow through on what you've planned to do. And one of the key things here is to continue to keep a mood activity diary, because we don't know that those things are definitely going to continue to boost your mood. So it's a bit of an experiment. So if you continue to keep a mood activity diary, it can help you to figure what things worked better or less well than you'd hoped. So again, at this point, I would just invite you to take a few minutes to think about what activities you currently do that lift your mood. If there are activities that you might be able to start to do that could lift your mood. And perhaps think about some of those things that are important to you and that really define you, that make you you, and what type of activities you could do that fit with that are realistic within your current life situation and circumstances and your current physical health. So while we're on the theme of activity scheduling, I just wanted to introduce another concept, and this is the concept of different types of activities that we have in a typical day. So often we have necessary activities in the day. So things that are necessary might include having something to drink or eat, might be taking medication, it might be going to work, depending on our circumstances. Then we have things that are routine. So I, for example, have a routine that I have breakfast, then I get showered and dressed, and then I go to work. Other people might get showered before they have breakfast. So we might have things that are part of our daily routine. And lastly, pleasurable activities. So these are the things that we enjoy, that kind of enrich our lives. And a question for us to ask at this point in time is, how's your balance between those activities? Because what we know is that if there isn't enough pleasurable activity, then your mood's likely to drop, or if it's low, it's likely to stay low. So again, I'd just invite you to have a think about what that balance between those three types of activity is. So here's the big idea in behavioural activation, and hopefully that's become somewhat apparent in the slides that we've covered already. So the idea is to follow your plan, not your mood. And sometimes that's easier said than done, and we'll come on to some tips in a minute. But the basic concept is that we're not reacting to our mood, we're not acting according to our mood. And an example from my own life is sometimes if my mood isn't so great, or if I've had a particularly difficult day at work, if I have a plan to go out with a friend in the evening, I might get home and think I really don't feel like it tonight, and I might cancel. So if that was the case, I would be acting according to my mood, not according to the plan. I might feel some initial relief. Oh, thank goodness, I don't need to go out. It felt like it was going to be an effort, but quite quickly then some negative consequences might kick in from that, or some negative feelings might kick in from that. So I might start to feel guilty. I might criticize myself a bit that I bailed out on it. I might then feel sad that I haven't seen my friend. So some of those unintended consequences kick in. If we flip it to following my plan, so if I followed my plan, I would go out even if I had a difficult day and even if my mood wasn't great. And it might be effortful at first, but typically within a little while of being out with a friend, I might then start to enjoy it and my mood starts to lift. I think the caveat here for people with physical health concerns is there might be times when your physical health symptoms or some of the treatment side effects make it difficult for you to do what you planned, and that's okay. So we're not saying follow your plan no matter what. If your physical health symptoms or treatment side effects get in the way, that's okay. But what you might then think about is there another time I could do it? Or is there something else I could do that would lift my mood instead of that thing? That is still going to be possible despite my symptoms and side effects at this point. So as I said, sometimes the idea of acting to a plan, not a mood, is easier said than done. The idea of scheduling activities and doing them is easier said than done. So here's a few tips, or here's a bit of a guide to troubleshooting if that's the case. So first of all, what got in the way? If there are practical barriers, is there anything that would help reduce those? Was it realistic? So what we don't want to be doing is setting expectations or targets for ourselves that are unrealistic and unachievable, because then all that's going to happen is we're not going to manage to do those things, and then we're going to likely be self-critical about it, and that's going to fuel that downward cycle. So was it realistic given your current circumstances, and particularly given your physical health condition at the moment and any treatment side effects? So it might be that you need to break things into smaller steps. One of the things that we often talk about with people that we see is the boom-bust cycle. So sometimes there can be a tendency when you're having a better day symptom-wise, or you're feeling more energetic, to try and pile everything into that day. And that can be great on that day, but what you then find is that the next day you get a rebound effect, and you might have a crashing low in terms of mood, but also energy and side effects and symptoms. So there is something here around pacing that might be really important. It might be that it wasn't the right activity to have tried, so try something different. I mentioned this before, but did anyone else know your plan? Sometimes making a social proclamation that you're going to do something can make it more likely that you're going to follow through. A common example of this is marathon, and I'm not suggesting you do marathons, but marathons or sponsored swims. I did one a few years ago and said and announced to the world or anyone who would listen or hear, I'm going to swim 100 lengths and I'm going to aim to do it in less than an hour. Once I said it, I was kind of committed to it, so it was more likely I was going to follow through on it. The other thing to say is sometimes it genuinely feels like you're just going through the motions, and you might feel quite numb or you might still feel quite low while you're doing it. And although that's not nice to feel at this point when you're trying to overcome low mood, that's okay. And that might be necessary just to get back into doing things. And by doing things, you're opening up the opportunity to get some kind of positive reinforcement or feedback or experience. And what's important to recognise there is that it's an achievement even to do those things, because the likelihood is that you're not doing them as often at the moment because of your mood. Another area I just wanted to touch on is how you might hold on to a better feeling. So sometimes when people start to schedule activities, they notice that their mood lifts, but as soon as they stop the activity, their mood drops again quite quickly. So some things that might help with that are, first of all, plan your next mood lifting activity. And it doesn't matter how small that is, and it doesn't need to be the same activity. But often, if you've got something planned in, even if that might not happen due to physical health or treatment or whatever, having something in the diary, having something planned can lift our mood. Talk to others about what you did and what you enjoyed about it. That helps to keep that experience alive and keep that memory alive in a way that then can help to maintain some of that mood. If it's appropriate, you might take photos and look back over those, or sometimes if I've been on if I've done something pleasant like a trip out, I might look at other photos online of that particular place or that particular activity, not necessarily my own, just to remember that particular experience. Sometimes it's just as simple as thinking about what you did and how you felt when you were doing it, and what it was that you enjoyed about it. So something about kind of reliving it in your head. We're really good at doing that for negative experiences or traumatic experiences, but we're not so good at doing it for positive experiences. So sometimes that on its own can be enough to lift our mood or keep our positive mood going. And finally, how do you boost the impact of the activities that you're scheduling in and trying to do? And again, there's a couple of extra things that we might build in at this point in time. So alongside rating your mood, maybe try rating how close you felt to others during that activity and your achievement in doing it. So now you're rating 3 different things. Make sure you're rating your achievement based on what's possible currently, not what you were able to do in the past. So it can be counterproductive to compare how well you did at something compared to how you were previously. So really classic example of this is exercise, for example. If you haven't exercised for a while, or you haven't been able to exercise for a while, when you go back to exercise, you're not likely to be able to do the same level as you did before. But if you're comparing your achievement today to what you were able to do 2 years ago or 3 years ago, then the likelihood is that you're going to view yourself negatively and your achievement negatively. An example of achievement here that I often use is around washing up. So if I'm at home and there's washing up all over the side, dishwasher's full, can't fit any more in there. Some of the things can't go in the dishwasher anyway. That does affect my mood if there are things all over the side. I can promise you when I'm washing up, my mood isn't great, but my sense of achievement while I'm doing it is relatively high. And when I have done it, my sense of achievement's high, and then my mood lifts. Are the activities aligned to your personal values and what makes you you? And are there enough of those types of activities or things in your day or week? So it can be helpful to think about an inverted pyramid here. So what are the things that are most important to you in terms of your personal values and what makes you you? And make sure that you've got the highest proportion of those things in. For things that are less important, have less of those things in. And for those things that are least important, have the least of those things scheduled into your week. So the final step that we're going to cover, and we won't go into enormous detail on this, but it's just to give a few tips, is how you start to tackle downward spirals. And the downward spirals really happen when our attempts at coping to depressed feelings lead to unintended consequences. So some of those attempts can unintentionally lead to a downward spiral. So what we're looking at doing here is catching that point where that downward spiral might start and see if we can set in motion a chain of events that leads to more of an upward spiral. So first off, looking at your mood or activity diary, are there times in the day or week or things in your schedule that are more likely to trigger those depressed thoughts or feelings? If there are, could you schedule some of the mood lifting activities for those times? So schedule those things in advance, or schedule those things for immediately after those things in your week or day or schedule that are more likely to lead to low mood, so that you've got a mood boost afterwards. Sometimes there really aren't clear times or triggers for those downward spirals. So if that's the case, then it's helpful to think about how might you spot some of those depressed or thoughts, feelings as they're happening. And then at those times, what mood lifting activities might be possible and realistically achievable. And then try to do those and implement those at the time. So in summary, no one chooses to be depressed or have low mood. It's often a response to internal and external factors. When we start to feel low or depressed because life's less rewarding, we can become stuck in a cycle where our responses or our attempts at coping with those horrible feelings unintentionally lead to a downward spiral of low mood. So to break the cycle, we can take a step-by-step approach to identifying and scheduling and trying out activities that make life a little more rewarding and lift our mood, no matter how small those activities are. Activities that give us a sense of achievement, give us a sense of closeness to others, or activities that are consistent with our values in life can help and often have the biggest impact. And if we can spot times or things that trigger our depressed thoughts or feelings, we can try to avoid doing things that lead to a downward spiral at those times. So I hope that this webinar has been helpful. I hope that some of the ideas and strategies and step-by-step approach that we've covered is something that you might be able to try out in your life or try out with loved ones. And I hope that that can help somewhat with any low mood or depression that you or they might be experiencing at the moment. So in terms of next steps, remember progress is never a straight line. Often there are hiccups or setbacks along the way. What we're talking about here, as we are in other types of psychological difficulties, is a cycle, and often that cycle has become quite embedded. So it can take some time to disrupt and tackle that cycle. So it's likely that some of the ideas in the webinar aren't going to be 100% effective 100% of the time right from the start. But it's important to continue to try to chip away or disrupt that cycle as much as you can. You might need to continually review and adjust the activities you're doing, particularly based on your physical health, if maybe your symptoms fluctuate or deteriorate or your position changes or your treatment changes. Sometimes people need the help of a psychologist or a counsellor or a therapist to work through this approach, and that's absolutely fine and understandable and okay. Sometimes that's with the earlier stages that we covered. Sometimes that later stage in terms of tackling downward spirals can be particularly difficult to challenge without a psychological practitioner to help. So if that's the case, details of our service can be found by searching online for Salisbury Hospital Clinical Psychology, or you may already have been referred to our service. If you haven't and you would like to be referred and you're under the care of the hospital, then I'd speak to your clinical team and ask them to make a referral. This is just one psychological approach to tackling depression or low mood. There are other psychological approaches that have a good evidence base behind them for being effective, and our team are trained in a range of those approaches, and some of those approaches focus on different areas. So for example, there are approaches that focus a lot more on negative thoughts and self-criticism and how to combat that. There are approaches that focus a lot more on acceptance and adjustment to physical health conditions or physical health experiences, or there are approaches that focus more on how you manage and navigate some of the relationships in your life and the impact that they have on your mood, or that your mood has on those relationships, and the impact of physical health on those relationships in the mix. So if this approach and the ideas in this webinar aren't entirely effective in trying to manage or overcome low mood, it might be that some support from a member of our team to apply this particular approach is helpful, or it might be that there are some other approaches that could be helpful and effective. And finally, some people may benefit from medication instead of or alongside psychological approaches to managing depression or low mood. So if that's something that feels like that might be the case to you, or might be your preference, or to speak to your GP or speak to your clinical team, they'll be able to talk that through with you in terms of what options might be possible and available, and if there are any contraindications with other medications that you might be taking. So as I say, I hope the webinar has been helpful. Please do dip in and out of the webinar. If there are other difficulties that you're facing, so for example sleep or fatigue or excessive worry, then we do have some other webinars that have got some advice and tips on how to manage those, and those webinars are slightly shorter than this webinar. So thank you for watching. I hope it's been helpful.